Let's bring in a couple of our Melbourne regulars now, Michael Kroger and Stephen Conroy. Gentlemen, a tough night. Michael, first to you. Stage 4 lockdown, curfew in place. It's really hard to fathom, obviously necessary, but tough restrictions.
Well, Kieran, I don't know where to begin. We've been at this for 5 months now in Victoria. We started in March, April, May, June, July, August. We've now had our second worst day today. The worst day was 2 days ago. I sort of feel it's a medical Ponzi scheme down here. To cover up the previous day's disaster, we announced a new plan. 3.5 weeks ago, we had a new plan for a 6 weeks lockdown. Now we've got a new plan for a stage 4, 6 weeks lockdown. I think most Victorians have lost confidence in this Chief Medical Officer here, Brett Sutton. We haven't seen any of the medical advice. We get tidbits from the Premier. We're told we've got a new plan every few weeks, and none of this is working. And, quite frankly, we've now got a curfew in Victoria. I just went for a walk with someone who's 80 who said to me, there was never a curfew even during the war. We've now got a curfew at 8 o'clock. I think it's a disaster here in Victoria. We've been if it hasn't been a shocking performance by the government, which I think it has been, it must have been pretty bad advice from the Chief Health Officer, because we're now in a much worse position than we've been for months, where every other state and every other territory seems to be doing okay, Kieran.
Stephen Conroy, it really is historic to see a curfew imposed, as Michael said there. Historic in so many ways, but, in this context of the pandemic, even New Zealand, which had a tough lockdown, they didn't go to a curfew. So obviously they've got their reasons, but what's your reaction? I understand Michael's anger there. It's been a tough few months.
Look, the evidence that the medical officers are recommending the curfew is based around that particularly people under the age of 30, 40 are continuing to spread it and not take social distancing measures seriously. And the curfew seems to be about trying to limit that under 30, under 40 age group who may not even realise that they have it, or that they have a tiny symptom that they may just think is a sniffle. As for Michael's ongoing campaign to support the Victorian Liberal Party, he's been at it for a few weeks now. The Prime Minister has said he's supporting the lockdown. He says he understands why we have to go there, but Michael's just now playing pure politics.
Michael, when you look at this next 6 weeks, Stephen says you're playing politics, but everyone's got to abide by it, otherwise they're facing thousands and thousands of dollars in fines, potentially prison time. So people are going to have to live with it, and even if they don't like it. How will businesses cope in the face of this lockdown?
And Stephen says people are playing politics. Someone has to do something, Stephen. We've been relying on your mob here for 5 months, and look at the mess we're in. No, I've spoken to a number of business people this afternoon. They're just going to shut their doors. They can't reopen. They won't reopen. They've got rental payments, leases that they can't meet. They've got staff who they're putting off. They've got, backlogs of payments for superannuation and other things dating back months because they've got no cash flow. The banks won't lend them any more money. It's a disaster. It's an absolute disaster down here. And you look at you take Michael McCormack's point of a minute ago, a very good point that was made by the Damien Drum, the National Party member up in the north in Victoria. There are many rural Victorian towns that have no virus, yet they're going to stage 3 lockdowns, meaning all shops basically closed except for the ones we know, chemists, supermarkets, etc. No visiting, etc. The performance here is out of control. I mean, if you want no more simple example, golf was allowed, allowed and now banned, all within 5 months. Do we think the medical advice, can we see the medical advice? Because, boy, it's not consistent, and the mess we're in now means that someone has to do something, Stephen, and that should be Morrison and the feds stepping in to do a lot more to help, and that fellow Brendan Murphy, in whom everyone has confidence, coming in down here to take over from the Chief Health Officer here who I just think has lost people's confidence.
Stephen Conroy, do you accept that that's a reasonable argument that
No,
some of
I
those
don't accept it at all.
that
Michael spent
said,
first. No,
the
not at all,
country
Kieran.
towns that have had no cases?
Michael spent the first 6 weeks of the first lockdown telling everybody that the medical advice was wrong, that they shouldn't be locking down. Michael's position on medical advice is now 180 degrees, the exact opposite to what it was
Stephen.
6 or 8 weeks ago. Just go and look at the tapes of yourself, Michael, where you were saying the medical advice is wrong, no one's dying, no one's getting it, we've got the lowest, we don't need these lockdowns. That was Michael Kroger 6 weeks ago.
Yeah, and that was
now
correct
we should have gone harder. We should have gone harder. We should have gone quicker.
That's absolutely
We should have gone
correct.
harder. We should have gone quicker, Michael.
The only problem we've had is your mate.
You're the only person propping up Michael O'Brien, and in truth, you're really trying to get Tim Smith up. So it's absolutely blatant what you're doing, Michael. Why don't you focus on the facts? And as for Brendan Murphy, whose medical advice was keep shaking hands, whose medical advice was, yes, we shouldn't lock nursing homes down because that's what the Prime Minister told him. Yes, we don't want kids under the age of at school, they don't transmit it. Now all the medical advice says, actually, common sense, 10 years old doesn't transmit it as much, but everyone above the age of 10. And then there's a face mask, Brendan Murphy. No, we don't need face masks. No one should bother them. They're actually dangerous to wear them, Brendan Murphy. So get back in your box, Michael, and focus on the problems that the state has got. The whole country, country needs Victoria to pull through this. And other than you playing cheap politics right now, the rest of the country is trying to solve the problem.
Well, mate, we've been relying on your mate
Michael
Andrews
Kroger, that is
for 5
true.
months, and it's
Before
been
I come to you,
disaster.
that point that Stephen said there, it is true that Victoria, we are all, willing success to Victoria because as Victoria goes, the rest of the country goes. It's a quarter of our economy. We've got, it's such a massive city. We need Melbourne to be thriving.
Yeah, but, hello, as if we don't know that. Everyone's willing Victoria to succeed, but, Stephen is the only one that perhaps hasn't noticed. Western Australia, South Australia, Queensland, Tasmania, the Territories, New South Wales, they're in one basket.
And you're opposed to their border closures the whole time.
Victoria's in the other basket. No, Stephen.
You demanded, where's the medical advice for closing the borders? You've been demanding that for 12 weeks.
Yeah, we've been following the advice of your friend Daniel Andrews, and look at the mess we've got into, Stephen.
You're in the Clive Palmer faction. You wanted all those border closures. That was disgraceful.
Stephen, don't put words into people's mouths. The bottom line is your man here in Victoria has been a disaster. The medical advice we need to see, no one sees it. No one's interested in hearing of another.
No one sees the federal advice.
You're like the board of a football club. Every year they've never won a premiership, and every year there's a new 3-year plan. Get rid of the board because we've got a new 3-year plan. That's what we're getting here.
Stephen, do you accept that there have been fundamental problems? Obviously, with quarantine, we know that. But we've been reporting day in, day out, the test results have been too slow, the tracing's been poor.
Absolutely. You had the initial problem where a number of security guards appear to have fraternised in a way that has led to all of this outbreak. All of this closure is ultimately down to the irresponsibility of a small group of individuals. That's not to excuse the government for having put those individuals untrained, unsupervised into that role, and there's an inquiry into that. Just like the Ruby Princess, there was an inquiry into. Michael wasn't demanding the minister's head there, or that Gladys was hopeless. People died as well from Ruby Princess. Michael's position then was, that's a little unfortunate. Okay,
well, Stephen,
then
don't keep making
tracing.
Up.
Then there's the tracing issue, and clearly they weren't getting information to people. But even when the people were waiting for the information and had the information, they were still going out and circulating. So we're now at a situation where we have a curfew, and people have to understand they've got to follow these rules. Therefore, their own good, therefore the people of Victoria's good, and most importantly, therefore the whole of Australia's good.
And Kieran, have you noticed the subtle shift? Have you noticed the subtle shift from Stephen and the Victorian Premier, which was that we don't blame anyone? In the last 4 or 5 days in Victoria, for those who are not Victorians, there's been a very subtle shift away from the government taking responsibility to blaming the community. Oh, it's a man who drove his car from Melbourne to Wodonga to buy some food. It's some people that had a party together, or it's some odd security guard here or there. None of it's the government's fault. Now they're starting to blame the community. This subliminal attack on, it's the proprietors of the aged care homes. Andrews always refers to private sector aged care homes. It's a very clever, subtle message shift, devolving responsibility from Andrews and the Chief Health Officer into the community, blaming Victorians for what is happening, when in fact, basically, the government here has had 5 months to get this right. It's been a catastrophe, and no amount of apologising or blame shifting by Stephen is going to make any difference to people's views down here.
Obviously, the government will be held accountable, for there's no doubt at that point. Do you think the federal government needs to step up with a pandemic leave scheme and to continue with the current JobKeeper, Michael? Is that what's needed in terms of business support?
Well, JobKeeper definitely in Victoria. Pandemic leave, I don't know, because I don't know the economics of it, quite frankly. But we know the cost of JobKeeper. It's essential in Victoria now that the borders are closed. It can basically be quarantined to Victorian employers and employees. Businesses are now going to be shut for a lot longer now. We've got a 6 weeks quarantine now till basically the middle of September. Well, a lot of businesses won't reopen. Some will take months to reopen. It needs to be extended well beyond September, October, probably into, the end of March until people get up and going. So you'd hope the federal government will come to the assistance of Victorian business. But on the other hand, the feds have got a limited amount of money. I mean, this whole printing money, new economic theory is complete and utter nonsense. There is a point at which the government can't keep issuing bonds to raise more money. There's a point at which the Victorian government has to keep putting its hand in its own pocket as well. Okay,
Michael and Stephen, I know it's a tough day for Melburnians and for all concerned, but I really appreciate your time this evening. We'll talk to you both soon.
Cheers. Thanks, Kieran. Cheers.